is Elsie Ross and I practice at UC San Diego in California. The work started 10 years ago, and it's crazy to think about that now, but 10 years ago I was a resident and I looked around at the healthcare system. I had a background in health policy. I went to London School of Economics and realized that the American healthcare system was very broken, but how do we fix that? Initially I thought maybe through some policy research, but ultimately, because I had a background in computers and computer science, I thought like giving clinicians information at their fingertips would help them make better decisions, and from more of a grassroots perspective, we can improve healthcare that way. For the vascular patient, I feel like they're kind of neglected in the cardiovascular space. Patients tend to be lower income, have less education, less wealth, and so they just have less access to resources, less access to primary care doctors. And we find that patients with PAD are often undiagnosed until they have a severe problem. So putting that all together, how do we improve care, potentially reduce the cost of care, and improve access for patients who are underserved? I wanted to build algorithms and models that could identify these patients and eventually predict their outcomes, and maybe one day help us even make treatment decisions for them. So I started off working with small data sets while I was a postdoctoral fellow. I finished my residency and gained a faculty position at university, and then decided to build models in our electronic health records so that, again, it would be kind of at our fingertips. So it was 10 years in the making of building these things, evaluating them, and seeing the best path forward. The funding is a game changer because it's over $3 million over 5 years to build powerful AI models that can detect PAD in diverse patient populations. So not just at one hospital, but across the country, at least in the US, because I'm US based, and to see if these models, when we put them in the clinician's hands, will actually change care. So we're gonna do a randomized study to see if AI can actually move the needle forward for peripheral artery disease. I'm very focused. I think the focus in working on something that started 10 years ago is how you get to this point early on. I've had great mentorship up until this date. So my mentors kind of took an approach of just advising and letting me kind of take the reins of where I wanted to drive the research, which was really helpful. And I just have a very supportive environment, and it's just the right time, right? Like it's kind of lucky to have been working on something 10 years ago that now everyone's talking about with ChatGPT and Alexa and all this other stuff. And so I think just the timing worked out along with all the hard work that went into it.